Hi everyone, I am Beatrice. In today's video, we will continue with psychiatric review of personality disorders. So we'll be looking at cluster B personality disorders. I've done a video on cluster A personality disorder, so be sure to check it out. Before the end of this video, I'll also review some NCLEX type questions on cluster B personality disorders. Cluster B personality disorders are characterized by impulsive and dramatic behaviors. There are four under these disorders. We have antisocial personality disorder, borderline personality disorder, histrionic personality disorder, and narcissistic personality disorders. Now let's look at the first one, the antisocial personality disorders. So these are the ones that violate societal norms. They don't keep to rules. They violate rules and regulation. Don't let the name antisocial because you are likely to think that it means they are not social, they don't socialize. No, it's actually from violating societal norms and rules. These people, they ignore rules, they ignore regulation, they can step on other people's toes, they step on others' rights, and they lack empathy, they don't care, there's no remorse with them. And these people, they are also aggressive, they have history of violence, and they are very manipulative. You need to take note of that. They are manipulative. This is a disorder where the person can exploit, let's say, their grandmother, somebody older than them, they can exploit their money and they won't even care. Or they can lie about somebody without showing any remorse, even when they discover that they are lying. Now, as a nurse, what are your rules? It's important that because you know that these people are manipulative, so ensure you stay neutral. And because you know they can exploit others, they can harm others, they have a history of violence, ensure that you watch out for safety of others. And because these people they always break rules, they break regulation, they don't keep to societal norms. So ensure that you are firm and firm in your decision making. Make sure you set boundaries, set limits with them. The next one is borderline personality disorder. So it's borderline. They are the one that have extreme mood swing. They swing between being very extremely good and happy with you. The next minute they are already fighting with you. They don't want to relate with you. So they have this extreme mood swing. They view things in extreme. So they don't believe in the middle. They either you are extremely bad or you are extremely good. So that's why we say they have what we call splitting defense mechanism. So splitting means they view things in extreme. They see things as either the thing is very, very good or it's very, very bad. They also see themselves that way, that either what they are doing is very good or it's very bad. So that's the splitting defense mechanism. These people, of course, they have unstable relationship. They have difficulty keeping friendship, initiating relationships. And another important thing is that they are at risk of self-harm. They are suicidal. So they have risk of self-harm, risk of suicide, especially when because they are borderline, as at the point where they are not happy, they are saying things as extremely bad, they could hurt themselves. So as a nurse, and your role is to ensure that you encourage them, devise means for them to cope, bring coping strategies, suggest things that can help them cope, especially when their mood is swinging. Also, you need to assess them for suicide, what them because they can hurt themselves. So ensure that you watch them at that point where their mood is not stable, ensure that they are not hurting themselves. So always assess them for suicide. For example, they can be idealizing someone today, but the next day they are pushing that person away. So that's borderline personality disorder. The third one is histrionic personality disorders. So these ones are the center of attraction. They are attention seekers. They enjoy being the center of attraction. Everyone put their focus on them. They easily become emotional. They can be tearful. They are the one that they can just start crying for just no reason, and they are telling you, oh, because you people don't care about me, you don't think about what I'm going through. So they are very emotional. They are dramatic. They are very flashy in dressing. They are very provocative in dressing. They use many colors. They have exaggerated emotions. They can be very tearful. This minute they are smiling, the next minute they can be crying, and they always feel that the attention should be about them. So these are the ones that it's all about me. So that kind of attention. They want to be the one that things are happening with. Everybody should be checked them up. Now your role as a nurse, encourage problem solving, set boundaries also, and you also give them that attention. Let's say they are crying. So at that point, take them to the room. Don't start asking them questions in the presence of people. All this, you hear a patient say, they don't like me, they don't care about me in this place. Everybody don't want to relate with me. They just abandon me. At that point, you need to take them to a place, a calm place, and speak with them. But also, you should also set boundaries because remember, they like to be the center of attraction. So you don't want a situation about all your attention will not be on them because they won't leave you. They can keep smiling with you at that minute. So ensure you set clear boundaries, clear limits with them also. The last one is narcissistic personality disorders. These are the ones that have grandiose sense of self. They believe they are more important than every other person. And these are the ones that can oppress others. They lack empathy. They are always all about me. Why should they put me with people in this category when they know that I'm more important, I'm more intelligent than them, I'm more. So these are the things you can, or words you can hear from them. They take advantage of others. So these are the ones that expect special treatment from people. They believe that they should be treated better than every other person. So these are patients that will tell you, oh no, I cannot take that you are giving to other patients. My me should be special, my this should be special. These are the kind of patient they believe they are more important, more relevant than any other person. Now, your role again with this disorder, ensure that you don't challenge them, be respectful, but at the same time, be firm and deal with only facts when you are relating with people with this disorder. Now, let's review some NCLEX type questions on cluster B personality disorders. Question 1. A client with borderline personality disorder says, I hate my doctor. He's useless, but you are the only one I trust. How should the nurse respond? A. I am glad you trust me. I will speak to your doctor for you. B. Your doctor is doing his best. C. I understand you are upset. Let's talk about what is bothering you. D. If you don't like your doctor, you can request for another. The answer will be C. I understand you are upset. Let's talk about what is bothering you. Question 2. A client diagnosed with antisocial personality disorder repeatedly violates unit rules and shows no remorse. What is the nurse's best response? A. You will be discharged if this happens again. B. Let's talk about why this behavior isn't acceptable. C. Your behavior is hurting others. Can you explain why? D. If you continue, you will lose your phone privileges today. The answer will be D. If you continue, you will lose your phone privileges today. Every other of the options, if you look at A, it's like a threat. For B and C, if you are trying to see if you can reason with them, they will not accept. So you remember you need to set limit with these people. So D will be the best option. Question 3. A client with narcissistic personality disorder refuses group therapy, saying, it is a waste of time being with people beneath me. What is the most appropriate response? A. You should try it anyway. B. That is not a respectful attitude. C. Group therapy helps everyone, even those who are highly intelligent. D. Let's discuss what concerns you about group therapy. So the answer will be D. Let's discuss what concerns you about group therapy. Even if we don't understand which personality disorder is talking about or their characteristics, always know that you'll never be wrong. When you try to understand what they are saying, you tell them, let's discuss about it. Most times, it will always be the correct answer. The last question. A client with histrionic personality disorder suddenly begins crying loudly and claims, no one cares about me while seeking attention in the hallway. What is the nurse's best approach? A. Take her to her room and calmly ask what's wrong. B. Ignore the outbursts. C. Ask her to calm down in front of others. D. Offer to get the doctor immediately. The answer will be A. Take her to her room and calmly ask what's wrong. Remember, you never ignore patients. That will never be the right approach. And when you are dealing with personality disorders or you are trying to relate to the patient or want to find out what is wrong, ensure that you ought to take them away from others, just to respect them before asking them or before inquiring, finding out what actually went wrong. So that wraps us today's topic on cluster B personality disorders. If you find this video helpful, please like, share, subscribe, and also leave your comments. Thanks for watching.